Okay, so we're back with our Director of Public Health, Steve Pintus. Thanks for joining me. So what's the situation like at the moment in North East Lincolnshire? How are we looking?
Yeah, it's very positive. The numbers have come down, and we're at some of the lowest levels in the Yorkshire and Humber region. They have plateaued and flattened off a little bit, and we must remember that we're still seeing hundreds of cases in a week. So we're nowhere near where we were last summer, which is really where we want to get to as we ease restrictions, and very much the variant that we saw first emerge in Kent is now very dominant in North East Lincolnshire. It's actually accounting for over 90% of all positive cases, and the key message about that is that it is far more infectious than the previous variant, and far more easily transmitted. And so we're seeing very small pockets of outbreaks that are quite explosive and spread very quickly through a workforce in a work setting. So it's really important that people stick to the guidance. I know that everyone's getting very fatigued and tired of it all and just want it to end, but it's really important to remember the hand, space, face message, making sure that we do keep socially distanced wherever possible, even when we're in our sort of recreational time, when we're going to work, coming home from work, just to remember that that it is very easily transmitted. So keep vigilant.
Okay. I guess the vaccine sort of naturally follows on from that. How's the vaccination programme going in this area?
Well, it's brilliant, and a real credit to all the staff involved. I mean, this is, it is unprecedented. Most of us, quite long in the tooth in our careers, have never seen anything quite like the effort that's been put into this vaccination programme, and we are beginning to work our way down the age groups. We are delivering vaccine. We're in the over 90% in terms of achievement, and that is a credit to all the staff in the clinical commissioning group, and of course in primary care, who are largely responsible for the success. And you will be aware that as we progress, we're now moving beyond the top 4 priority groups. They met the deadline set by government to achieve that. Everyone in that group's been offered by the 15th of March, and now we're extending it down to the next set of priority groups. And we anticipate the same level of success that we've seen in the previous priority groups with the new priority groups.
That's brilliant. So the government made an announcement in the last couple of days about more and more people being added to that list of vulnerable people and clinically extremely vulnerable, and they're being asked to shield. What can you tell us about that?
So it's useful to remember that the rationale behind the priority groups set nationally was to protect the most vulnerable from illness and sadly death. Now what they've done is they've developed a tool nationally to review all the variables that can actually increase a person's likelihood of falling ill or seriously ill from COVID. And they've added those variables from experience from the first and second wave to make this tool that identifies people that particularly with long-term conditions that are actually more vulnerable. So in doing so, they have pushed them up the priority list in terms of the vaccine, quite rightly, but also because they've been identified at greater risk, have added them to the shielded list. So they're suggesting to those people that they ought to follow the shielding guidance. This is being driven nationally, and those people will be informed in the coming days with a letter coming from the centre to advise them on what to do.
Okay, that's brilliant. So there's also been some big announcements locally this week about testing and doorstep visits by the test and trace team. Can you tell us a bit more about those?
So this is the other element that's really important. So we've got to remember that the vaccination primarily there is to prevent illness and death in the most vulnerable. What we're still unclear about is the vaccination's impact on transmission, whether it actually reduces the chance of transmission. So it's really, really important that people remember that just because people have had the vaccination doesn't mean that's a license to go out and ignore all the restrictions. The guidance still applies. So it's really important that we keep an eye on transmission and preventing transmission. So we've extended the testing regime, and we're targeting all of those critical workers that are having to go out. They can't work from home, but they're going out to work, and they are at risk either of transmission or that they work with particularly vulnerable people. So we've set up testing centres and a booking system to enable access to businesses, employers that have staff that meet that criteria. In the private sector, that's businesses under 50 employees. Anyone with employees over 50 employees, that they apply to the national programme, and they'll get support via that route to set up testing in their workplaces. So this is just started. It's only just begun, but we did about 180 tests, I think, in the first week, and we anticipate that will grow in numbers. This is important that we test to find cases that may be asymptomatic. So the estimate is about 1 in 3 people don't know they've actually got it because they don't have symptoms. So the sooner we find those cases and support them to self-isolate, the more likely are to break transmission and keep on top of the virus and prevent it spreading. The door knocking or the contact that you refer to is that we really want to make sure that people can cope with the self-isolation that's required if they have a positive test. So we are just following up people to check that they've got everything they need, that they're not financially disadvantaged, that they can get access to the financial support, and they have friends and a network that can provide the support around shopping or any other needs that they have. So we are making sure that we support people wherever we can to ensure that the self-isolation isn't detrimental, and that people can self-isolate, because that is the most important measure. It is the isolation that works, that breaks the transmission.
Brilliant. Okay, Steve, is there anything else you want to add before we sign off?
No, I think that was it, Bryce. I think that's great.
Brilliant. Okay, we'll call it there. Thank you ever so much, Steve, and maybe catch you next week.
Certainly.